It used to be said GMH stands for get me to Hawaii, get murdered here. But today it stands for great or good medicine here. Well, we need to continue to build on that and ensure that our public, our people, this is their only community hospital, has confidence in the type of that is safe and quality care that's taking place up there. And one of the things that I spoke about just a few minutes ago was what we should do next. And I think that if we can refer back to that as far as building the new Guam Memorial Hospital Regional Medical Center of the Marianas. On the issue of the Obama healthcare bill, that unfortunately is we've spoken to most of our counterparts in many different states, and all of them are all wondering the same thing. Well, how is this exactly going to affect each one of our states? How is this going to affect our community here on Guam? It's an 11,000 page, almost 10,000 page document that the rules and the regulations continue to come out. Just recently, there was found that in one of there was a little loophole that allowed for abortion to take place. But for Guam in particular, here are some of the concerns that we have. One is that we do know that there is going to be increased funding for Medicaid, and that's going to take place over multiple years in a going forward, where we're going to increase the amount of Medicaid dollars that's coming to Guam. The problem is that as you increase the amount, they've not changed the match. And so as we increase the amount of money coming from federal government, Guam's now going to need to try to figure out where to get the 50% match to ensure that. And when you increase the eligibility of the number of people that are going to be able to be eligible for Medicaid by a significant amount, we're estimating that's going to be upwards of 60,000 people. And so our concerns is that, okay, if you increase the number of people coming to public health and to any of the clinics that are wanting to take Medicaid, but where are we going to get the staffing? Where are we going to get the doctors to be able to do it? And we're not alone on this one. It's also the rest of the states and the rest of the other jurisdictions, including the territories. I know that the health insurances here on Guam are concerned because that they feel that in 4 years, at least this is what I've heard, is that they feel that within 4 years after the implementation of the public option here in Guam, that it's going to run them out of business. Well, these are some of the concerns that we have too. We need to be able to look at that to ensure that our health insurance industry would not be significantly or adversely affected in regards to that.
Well, when we start talking along those lines in terms of raising the number of, basically, in essence, having the possibility the number of people who will be eligible for Medicaid would rise, and of course that would, because we're going to see an influx of people, that really leads to a whole different discussion in terms of taking a look at where a lot of the people are coming from. And right now, I know over the past several years, we've seen a lot of our brothers and sisters from the Micronesian region coming out here because of the medical facilities that we do have, and of course the economic opportunities. So one of the things that Mike and I have always talked about is, again, when we approach this build-up and all the opportunities going forward, we should be talking about also how do we help our neighboring islands help develop their own economies, because with that then they also will probably be able to start generating the revenue they need to upgrade their own facilities, their medical facilities, their educational facilities, as well as job opportunities. And we may not see the influx of people who are just coming here just for medical reasons. If we help them develop their economies, they can provide for their own people. And I think this will alleviate the situation on Guam and really help the whole region.